The insurance industry and its supporters in Congress have tried to portray this as radical change. I just want to be clear, everybody, listen up. Because we have heard every crazy thing about this bill. You remember. First, we heard this was a government takeover of health care. Then we heard that this was going to kill Granny. Then we heard, well, illegal immigrants are going to be getting the main benefits of this bill. They have thrown every argument at this legislative effort. But when it turns out, at the end of the day, what we're talking about is common sense reform. If you like your doctor, you're going to be able to keep your doctor. If you like your plan, keep your plan. I don't believe we should give government or the insurance companies more control over health care in America. I think it's time to give you, the American people, more control over your health. This is a patient's Bill of Rights on steroids. Starting this year, insurance companies will be banned forever from denying coverage to children with pre-existing conditions. Starting this year, insurance companies will be banned from dropping your coverage when you get sick. And they've been spending a lot of time weeding out people who are sick so they don't have to pay benefits that people have already paid for. Those practices will end. If this reform becomes law, all new insurance plans will be required to offer free preventive care to their customers. If you buy a new plan, there won't be lifetime or restrictive annual limits on the amount of care you receive from your insurance companies. And by the way, to all the young people here today, starting this year, if you don't have insurance, all new plans will allow you to stay on your parents' plan until you are 26 years old. The second thing that would change about the current system is that for the first time, small business owners and people who are being priced out of the insurance market will have the same kind of choice of private health insurance that members of Congress give to themselves. And by the way, if you're curious, well, how exactly are we saving these costs? Well, part of it is, again, we're not spending our health care money wisely. So, for example, you go to the hospital or you go to a doctor and you may take 5 tests when it turns out if you just took 1 test and you sent an email around with the test results, you wouldn't be paying $500 per test. That's what the Congress of the United States is about to vote on this weekend. Now, it would be nice if we were just kind of examining the substance. We were walking through the details of the plan, what it means for you, but that's not what the cable stations like to talk about. What they like to talk about is the politics of the vote. What does this mean in November? What does it mean to the poll numbers? Is this more of an advantage for Democrats or Republicans? What's it going to mean for Obama? Will his presidency be crippled? Or will he be, or will he be the comeback kid? You know, that's what they like to talk about. That's what they like to talk about. I understand. Yeah, one of the things you realize is basically that a lot of reporting in Washington, it's just like SportsCenter. It's considered a sport. And who's up and who's down, and everybody's keeping score, and you got the teams going at it. It's rock'em sock'em robots, you know. Look, let me say this, George Mason. I don't know how this plays politically. Nobody really does. I mean, there's been so much misinformation and so much confusion, and the climate at times during the course of this year has been so toxic, and people are so anxious because the economy has been going through such a tough time. I don't know what's going to happen with the politics on this thing. I don't know whether my poll numbers go down, they go up. I don't know what happens in terms of Democrats versus Republicans. But here's what I do know. I do know that this bill, this legislation, is going to be enormously important for America's future.
And if you believe that it's right, then you've got to help us finish this fight. You've got to stand with me just like you did 3 years ago and make some phone calls and knock on some doors, talk to your parents, talk to your friends. Do not quit. Do not give up. We keep on going. We are going to get this done. We are going to make history. We are going to fix health care in America with your help. God bless you, and God bless the United States of America.